It's really scary because I couldn't even walk into the emergency room. I had to be like wheeled in.
Kaylee Hardenbrook, once a healthy mother of 2 young children, was on the verge of death. At first, she was stricken with flu-like symptoms.
I wasn't hungry, I wasn't thirsty. All I wanted to do was sleep.
So she went to a hospital, but doctors couldn't figure out what was wrong.
They sent me home. They said I was just dehydrated. A couple of days later, I went back to the same hospital. Same results, sent me home again. Then I had a seizure. My husband had put me in the car. His sister happened to run their neuro unit at the hospital. I remember looking at her. I told her, Teresa, I think I'm gonna die. And then that was the last thing I remembered.
Kaylee slipped into a coma. Meanwhile, doctors worked to figure out what was making her so sick. They diagnosed her with a rare and deadly mosquito-borne virus called Triple E, Eastern Equine Encephalitis. There is no cure and no FDA-approved vaccine. Doctors told her family the outlook was grim.
They had made arrangements for the kids to come in and kind of like say their goodbyes. I'm pretty sure I just fought with everything I could to be here for them.
The road to recovery was long and difficult. 1 month in the hospital, 8 weeks of rehab.
They told me that there was a chance I would never walk again. So I'm like, well, that's definitely not going to happen. You don't know me. Definitely not happening. I have 2 small boys. I had to learn how to use the bathroom again.
Now, 5 years after Triple E almost killed her, the same virus is popping up in states across the U.S.
New game plan against Triple E.
The mosquito-borne illness
is the worst it's been.
It can be potentially deadly,
including in Kaylee's hometown of Paw Paw, Michigan.
The odds of me getting it again are slim to none, but it is definitely terrifying that it's like right in your back door.
It can really strike anyone of any age.
The disease has claimed at least 9 lives in 4 states, including Michigan, Rhode Island, Massachusetts, and Connecticut.
This is a serious public health concern.
There are reportedly around 30 confirmed or probable cases in 7 states. Those diagnosed with Triple E are fighting for their lives, like 5-year-old Sophia Garabedian. After several weeks in Boston Children's Hospital, she's recovered enough to be moved to a rehab facility. Communities in affected areas aren't taking any chances. Paw Paw School District Superintendent Rick Rio sent home cautionary letters.
We've gotten information out to our parents regarding safety precautions that they can use to keep their kids safe.
Good.
They're also hitting the brakes on nighttime football games.
All of our contests have to be played before dusk. They try to get everything done before the sun goes down. The other things that they've done is recommended mosquito spray and bug preventative stuff. It's affecting everything around here as far as homecomings and Friday night lights.
It's hard to say which part of the population is more at risk for Triple E virus. One of the factors is which part of the population is outside. Is it retired people that are gardening a lot? Are the children outside doing activities?
In Bristol County, Massachusetts, 59-year-old Lori Sylvia and 78-year-old James Longworth both died from Triple E infections in the past month.
There really is no steady predictor as to which community this is going to pop up in. Even though it's known as an East Coast virus, there are just as many cases in Michigan in the last decade as there had been in Massachusetts before this year.
In Michigan, 14-year-old Savannah D. Hart was hospitalized last month after contracting the virus. Her mom says it's been an emotional roller coaster.
Our whole lives have been flipped upside down. The tears flow just when they flow. They just come out whenever they want at this point.
Savannah is now in a rehabilitation center, but her mom says she has very extensive brain damage as a result of the virus.
She's just one day at a time. We're taking it with her right now. That's all we can do, really. I just want to hug her and kiss her and tell her I love her, and I want her to be able to hug me back.
Symptoms of Triple E develop 4 to 10 days after being bitten by an infected mosquito. Triple E cases may vary in severity. Some are characterized by chills, fever, muscle, and joint pain, and usually subside within 1 to 2 weeks. Other cases have neurological involvement and are far more extreme.
So infection with Triple E virus causes flu-like symptoms. It will start with headache, lethargy, fever, and it can progress to neurological symptoms, disorientation, and in severe cases lead to coma and then even death.
About 1/3 of Triple E cases with neurological involvement are deadly, according to the CDC. Many who survive Triple E are left with permanent neurological damage. But still, the disease is very rare. Between 2009 and 2018, there were 72 reported cases of neuroinvasive triple E in which the virus infects the brain. By comparison, during that same time period, there were more than 12,000 reported cases of neuroinvasive West Nile virus. Of those, 1 out of 10 died.
There is a bit of an alarmist quality right now with the media reports, given that it is so rare, but it only takes one bite. And with a 40 to 60% fatality, this is a real risk that people need to take seriously.
Over the past month, Massachusetts has undertaken aerial and ground spraying.
This is a serious issue for the Commonwealth, and we will continue to devote the talent, the resources, and the time to helping our community partners and to preparing for the future.
In Framingham, Massachusetts, public schools are canceling outdoor recess until temperatures cool.
It's a difficult decision. I know people are not too happy about that. The first hard frost can't come soon enough, frankly.
People in affected areas are being encouraged to use bug spray, wear long sleeves, high socks, closed-toe shoes, and hats. Removing trash and standing water may also help.
We've kind of walked our grounds, had our maintenance department working and looking at eliminating any standing water because that's breeding ground. Some schools, including ours, are looking at doing some spraying around the wet areas around the school district.
Medical officials say mosquitoes may stay active even as temperatures cool. The first hard frost of the season will likely end this year's mosquito worries.
What did you do today?
As for Kaylee, she says she's just lucky to be alive.
My doctors told me pretty much the whole time that I was lucky that I was young and I was healthy. And like I said, I just really always kept a positive attitude. If I'm going to go out, I'm going to go out a way cooler way than a mosquito bite.
Her biggest priority now is keeping her 2 children, ages 5 and 8, safe.
I typically spray them in the morning recently just because it's been getting so bad. I try not to be a worry wart, but if you do get it, it's scary. I do flip. Whoa.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.